Hello everyone. Today we are going to see about the fifth goal of our international patient safety goals, which is reducing the risk of healthcare associated infection. So this will be comprising of two major things. One is hand hygiene guidelines, the healthcare associated policies. So in a hand hygiene, what can be done? The two major things that will be striking your brain is that doing the hand rub at the patient bedside whenever necessary by following the 5 moments of hand hygiene. So what are the steps we do? Yes, we take the product from the patient put in, especially chlorhexidine can be taken. Then we are going to apply palm to palm. Then over the right palm over the left dorsum and the left palm over the right dorsum and vice versa with interlaced. Then you are going to do with palm to palm with fingers interlaced. Back of the fingers opposing the palms with interlaced. Then you are going to do the thumb rotation. After the thumb rotation is being done, we are going to do the fingertips in rotation, then the wrist, and finally the hands are safe. The next thing is that we will be applying this moments of hand hygiene in case of 5 major moments, that is before touching the patient, before clean or any aseptic procedure, after touching the patient, after blood or body fluid exposure, after touching the patient's surroundings. So simply you can keep it in the as a mnemonic, that is BABA. Before touching the patient, before clean and aseptic procedure. A is after body fluid exposure, after touching the patient. And again B you can come across this one and A. So this is how we keep the mnemonics and apply to the patient whenever you handle the patient. So in this safety bundle, we will be again applying the care bundles, which is already shown in the November month lecture series. Please go through that. I have covered about the WAP bundle as well as the COTI bundle. So in WAP bundle is nothing but ventilator associated pneumonia bundle. Here we will be giving more importance on the elevation of head and giving oral care every second hourly or every shift by chlorhexidine rub, and then you're going to use the chlorhexidine mouthwash, and then you're going to use the anti-prophylactic prophylaxis for stress ulcers, and daily sedation, deep vein thrombosis prophylaxis with Flotran pump. So this will be implemented for preventing ventilator associated pneumonia when the patient is on a ventilator. If the patient is on a catheter, then we have to plan for catheter associated urinary tract intervention, infection prevention bundle. So this will be carried out before insertion, during insertion, and after insertion. And in order to prevent the central line associated bloodstream infection, we will be using the CLAPSI bundle, and which is nothing but like having the patient temperature throughout normal in pre-operative, intraoperative, and post-operative, maintaining the glycemic control in pre, intra, and post, and seeing that the using the skin preparation with 4% chlorhexidine, and then supplemental oxygenation at all times, using skin antiseptics around 4%, glove change in case there is a chance for infection in between the procedures, separate wound closures tray, smoking cessation prior to the procedure, wound edge protectors to prevent the infection, and decolonization with antibiotic prophylaxis, mechanical bowel preparation, and oral antibiotics. So the visual and the last important infection relevant to hospital will be the thrombophlebitis. So in order to prevent that, we will be using the VIP scale, visual infusion phlebitis score scale. So if the score is 0, then it shows that there is no signs of phlebitis. If the patient is complaining of pain at the IV site and there is redness, then the score is given of 1. Check the cannula, that is the intervention. Then if the score is 2, that is if the patient is complaining of pain, erythema and swelling, then the score is 2. See that you have to remove the cannula and place a new cannula in the other side. And if the patient is complaining of erythema, induration along with pain, then we have to remove the cannula, and which is the medium side of phlebitis. And if the patient is going to have pain, erythema, induration as well as the venous cords are palpable, then the patient is getting a score of 4. Resite the cannula and consider the treatment. If the patient is going to have all the above complaints along with pyrexia, that indicates the patient is having advanced stage of thrombophlebitis, then we have to immediately start the treatment for thrombophlebitis like applying Maxell dressing and so on. And I hope you all understood of how we can prevent the hospital-acquired infection in our fifth goal. So that's all for today. Thank you all. So if you have any doubts or suggestions, please don't forget to put under the comment box. Please like, share and subscribe. Thank you all for your patience.